of you must be keeping good health. Today, we are going to discuss a very important topic, benign prostatic hyperplasia, BPH. So, BPH is the non cancerous enlargement of the prostate. Usually begin in the 50s in men, and in many men, it may cause obstruction to urine flow. Many a times they have to get up and go to the toilet at night, and is one of the most troublesome aspect of this condition, as it makes them tired during the day as well. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events such as theater, etc., rather difficult. A doctor, such as a urologist, can treat this condition and help the patient to get relief. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Akash Bande, MS, MCH Urology. He has a rich experience and hands on expertise in stone management as well as in treating urological problems. He is currently practicing at My Health Multi-Speciality Clinic, Nagpur. Dr. Akash has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. Akash.
Thank you.
So, Dr. As today we are going to talk about BPH, benign prostatic hyperplasia, जिसे बहुत आम तौर पे हम नॉन malignant enlargement of prostate या prostate बढ़ गया इस तरह से भी जानते हैं. But first of all, we would like to understand, doctor, what is prostate? ये क्या gland है? कहाँ पे होता है males में?
Actually, prostate is a part of our urinary, rather, it's a sexual organ which lies just below bladder and through which one tubular structure called urethra passes out. मतलब यूरिन पास करने की जो नली है वो प्रोस्टेट के अंदर से जाती है और ये ब्लैडर के जस्ट नीचे सिचुएटेड होता है और
Okay.
उसका मेन काम है जो सीमेन रहता है सेक्सुअल फ्लूइड. It produces most of the contents of semen. So it produces secretions which are part of semen.
ओके. तो जैसे कि हमने अभी बात की कि ये एक मेल ग्लैंड है, मेल्स में ही होता है और ऐसे में लाज़मी है कि
Yes.
बीपीएच की जो कंडीशन है वो मेल्स में होती है। बीपीएच के लिए कहा जाता है इट्स अ साइन ऑफ एजिंग, मतलब ये उतना ही नेचुरल है जितना बालों का सफेद होना है या रिंकल्स आना है आफ्टर अ सर्टेन एज। इज दैट ट्रू,
Yes,
डॉक्टर? किस
yes.
तरह से बीपीएच को हम समझे?
Yes, it is actually part of normal aging process. Means as any man ages, means as his age increases, the duration of testosterone exposure increases. Basically, testosterone is produced by in every male through its testes, and this testosterone is the main food for prostate. And as more and more years of exposure of testosterone happens, that prostate keep on increasing in size. And particularly, it starts trouble after age of 55 or 60. By that time, prostate enlarges sufficient enough to produce problems.
Okay. Now, as it is so common after a certain age, so when a man should be, alert about it, कि अच्छा मैं इतने साल का हो गया, so now I should be cautious or get it checked, etc.
Usually, this type of problem starts after age of 55 or even more common after 60s. So anybody having any trouble in urine should come to urologist and get its evaluation done. And most of the times that problem is because of the prostate, particularly in old age.
And as you said, if anybody has these symptoms or any problem related with urination, they should go and get it checked with an urologist. डॉक्टर, हम समझना चाहेंगे कि symptoms क्या है? अगर बीपीएच है, तो किस तरह के symptoms देखने को मिल सकते हैं?
देखो, सिम्टम्स समझने के लिए अपने को एक चीज ये समझना जरूरी है कि जो अपना यूरिन का पैसेज है, मतलब यूरिन पास होने की जो ट्यूब है, वो ट्यूब प्रोस्टेट के अंदर से जाती है. तो व्हेन प्रोस्टेट इंक्रीजेस इन साइज, इट कॉजेस सम ऑब्स्ट्रक्शन टू द आउटफ्लो. तो इसके सिम्टम्स क्या हो गए कि यूरिन का स्पीड स्लो हो जाएगा, जैसे यंगस्टर्स उनका यूरिन दूर जाता है ओल्ड एज में, या बिकॉज ऑफ प्रोस्टेटोमेगाली और एनलार्ज प्रोस्टेट, यूरिन पैर के पास ही गिरेगा। यूरिन एक
हम्म,
इसमें पूरा कंप्लीटली बाहर नहीं आएगा, रुक रुक के आएगा। या रात में नॉर्मली उठने की जरूरत नहीं पड़ती है, लेकिन एक बार मैक्सिमम अगर उठना पड़ता है तो दैट इज ओके, बट इफ अ पर्सन नीड्स टू वेक अप 2 to 3 times or even more in night to pass urine, then that is one alarming sign of prostate enlargement. Again, because there is outflow obstruction, पूरा यूरिन completely खाली नहीं होता, तो ब्लैडर में कुछ बैलेंस रहेगा जिसको हम पोस्ट वाइड रेसिडुअल यूरिन बोलते हैं, जो कि हमें अल्ट्रासाउंड में पता चलता है। और बिकॉज पोस्ट वाइड रेसिडुअल यूरिन ज्यादा होता है, मतलब
I think there is some technical issue. Right now, we have lost our doctor, but I'm sure he'll get back. So, we are today talking about BPH, benign prostatic hyperplasia. प्रोस्टेट ग्लैंड है, जैसा कि डॉक्टर आकाश हमें बता रहे थे, जो कि मेल्स में होता है। एक सेक्सुअल ऑर्गन इसे हम कह सकते हैं कि कोई सीमन का जो मैक्सिमम है वो यहाँ पे बन रहा होता है। वेलकम बैक डॉक्टर, वी लॉस्ट यू
या
फॉर
या
फ्यू
या
सेकेंड्स।
यस
बट
यस यस
एनीवेज, सो हम बात कर रहे थे सिम्टम्स का।
सिम्टम्स, यस। तो यूरिन पूरा खाली नहीं होने के कारण ब्लैडर ऑलरेडी थोड़ा भरा हुआ रहता है, तो बार बार यूरिन के लिए जाना पड़ता है पेशेंट को। अर्जेंट बाथरूम के लिए, मतलब whenever he gets sensation or desire to pass urine, he cannot wait, he has to go to bathroom urgently. Then after passing urine, patient will get sense of incomplete emptying, means उसको लगेगा कि कुछ यूरिन बचा हुआ है। So these are the main symptoms of prostatomegaly.
बिल्कुल। ये जो आपने सिम्टम्स बताया डॉक्टर, यूरिनेशन से ये रिलेटेड है, और जैसा कि आपने बताया, क्योंकि जो पैसेज है यूरिन का वो प्रोस्टेट से होकर गुजरता है, तो ऐसे में जाहिर सी बात है कि अगर प्रोस्टेट बढ़ेगा तो उस पर प्रेशर आएगा और यूरिनेशन से रिलेटेड जो सिम्टम्स आपने बताया वो होंगे। लेकिन ये जो सिम्टम्स हैं, ये दूसरी चीजों से भी कई बार एसोसिएटेड होते हैं, और यही वजह है कि कई बार जब ये
Yes,
सिम्टम्स
yes,
होते हैं तो लोग अनदेखा कर देते हैं कि अरे मैं तो डायबिटिक हूँ, तो ये सिम्टम्स तो होते ही हैं। और आई एम एजिंग, तो ये सिम्टम्स तो होंगे ही। या दूसरे इश्यूज हैं तो ये सिम्टम्स तो। और ऐसे में लोगों को कई बार शायद पता नहीं होता, या पता होते हुए भी वो उसे इग्नोर करते हैं कि ये
yes.
प्रोस्टेट से जुड़ा हुआ मामला हो सकता है, ये ट्रीटेबल है, रिलीफ हमें मिल सकता है। तो किस तरह से वो व्यूअर्स हमारे साथ जो जुड़े हुए हैं, और मे बी वो भी अभी तक ये इग्नोर कर रहे थे एज अ साइन ऑफ एजिंग और एसोसिएटेड विद अदर कॉम्प्लिकेशंस, मेडिकल कंडीशंस, उनको आप क्या कहना चाहें?
Actually, anyone who is having similar type of problems, what I discussed just now, तो बेसिकली इससे क्वालिटी ऑफ लाइफ बहुत सिग्निफिकेंटली अफेक्ट होती है। जैसे
बिल्कुल।
किसी को रात में 4 बार 5 बार अगर उठना पड़ रहा है, मीन्स एवरी आवर ही इज वेकिंग अप टू पास यूरिन, तो उनकी स्लीप डिस्टर्ब होती है। स्लीप डिस्टर्ब होने से उनका नेक्स्ट डे रूटीन जो है वो थोड़ा डिस्टर्ब होता है। फिर उनको अगर जैसे फ्रीक्वेंसी, अर्जेंसी, ये सिम्टम्स है, तो जैसे वो बस से जाना है या फिर ट्रैवल करना है, देन इट विल बिकम वेरी डिफिकल्ट फॉर देम। देन अगर यूरिन पूरा नहीं हो रहा, समटाइम्स इट कैन कॉज इवन रिटेंशन ऑफ यूरिन, मीन्स पेशेंट विल नॉट बी एबल टू पास यूरिन बिकॉज ऑफ एनलार्ज प्रोस्टेट। तो
हम्म।
ऐसे सिचुएशन में उनको कैथेटर वगैरह डालना पड़ेगा। बट ऑल these things can be managed very well by different modalities, like such as initially lifestyle modification, then medical management, and sometimes surgery. So
ओके।
there are good treatment options available, and which are quite effective in treating this condition of enlarged prostate.
Right. So whatever treatment options you just mentioned about lifestyle modification, medical, management or surgeries, we'll talk about them in length as well. लेकिन उससे पहले डॉक्टर ये भी आपसे जानना चाहेंगे कि चूंकि हम सिम्टम्स की अभी बात कर रहे थे, कई बार ऐसा होता है कि ये सिम्टम्स नहीं नजर आते हैं, ये सिम्टम्स महसूस नहीं होते हैं, लेकिन किसी और वजह से जब स्कैन्स, अल्ट्रासाउंड किए जाते हैं, कई बार रूटीन एनुअल चेकअप होता है, उसमें पता चलता है कि प्रोस्टेट बढ़ा हुआ है, एनलार्ज्ड है, लेकिन सिम्टम्स नहीं होते, और वो लोग बड़े सरप्राइज होते हैं कि अच्छा, हमें तो कोई सिम्टम ही नहीं था, फिर डॉक्टर के पास जाते हैं। तो ऐसे में क्या करना चाहिए? अगर सिम्टम नहीं है तो भी
This
क्या एक
is
बार
this is
एनुअल
good
चेकअप
point.
कराते रहना चाहिए?
This is very good point. See, the thing is, prostate doesn't enlarge in one day or one week. It is the continuous process, and many people, many old men I see whenever I ask, because being a urologist, I ask questions related to urine to every patient, and they will say, "हाँ, urine तो अच्छा होता है." But when we check their uroflowmetry, their speed will be very less, flow rates will be very less. On ultrasound, we will come to know कि his post void residual urine यानी कि यूरिन पास होने के बाद जो बैलेंस है वो 350 ml है, 400 ml है. So because patient gets habituated, he starts thinking कि yes, it is normal. But
Right.
no, it is not normal. If you think कि when you were young, the way you was passing urine and the way you are passing urine now is different, means there is some problem. So every male after 60, at least once in a year, he should take one urologist opinion for this type of problems, or even if he has no problem, at least once he should consult. And based on the severity, or many men don't even need any medical treatment or surgical treatment, but
Mm.
there should be one consultation with urologist regarding this problem. Because consequences or complications of this condition are very bad, and in fact sometimes life threatening, because of prostate problem there can be uh, lot of residual urine in bladder, which can give back pressure changes to kidneys, and ultimately kidneys may start worsening their functioning, means ultimately patient may end up into kidney failure. He may get
Mm.
recurrent UTI, then and bladder stones, recurrent bladder stones. So there are multiple problems which, if not managed properly before,
Right.
can worsen the life, and even it can be life threatening ultimately.
So the potential complications if left untreated are life could be life threatening as well. So please do not ignore the symptoms. If you have the symptoms, even if you feel there is a slight change in whatever pattern, please go and consult. And as the doctor have just said, if you are 60 plus, please make it a point that annually you'll go and get yourself checked with an urologist as well. ये बहुत जरूरी है क्योंकि जो कॉम्प्लिकेशंस है वो बहुत ज्यादा वर्स हो सकता है और इनिशियली अगर आप दिखा दें तो हो सकता है सिर्फ लाइफस्टाइल मॉडिफिकेशन से ही
Yes,
चीजें
yes, yes,
संभाल ली जाए। तो उस पर हम
yes.
अब बात करना चाहेंगे डॉक्टर, क्योंकि आपने कहा था कि बहुत तरह से इसे ट्रीट किया जा सकता है, लाइफस्टाइल मॉडिफिकेशन है, मेडिकल मैनेजमेंट है, सर्जरीज है। इस पर हम चाहेंगे आप थोड़ी और बात
Basically, there are multiple things in lifestyle modification which are very simple to follow actually, and which are the cheapest, or in fact they are free of cost, because patient himself has to change his life. That's all. Nothing fancy or nothing new has to be done. Only thing is, like, अगर पेशेंट को प्रोस्टेट प्रॉब्लम है, many patient they find it difficult to pass urine when bladder is over distended. मतलब अगर लंबे समय के लिए यूरिन के लिए नहीं गए तो यूरिन स्टार्ट करना बहुत डिफिकल्ट होता है. तो बेसिकली देयर इज नो नीड टू वेट फॉर 5-6 hours. Every 3-4 hours patient should go and pass urine whether he feels or not. Second thing is, there should be control on water intake, like the person who has to wake up 4-5 times in night, if he decreases his water intake in evening, means after 5 o'clock, that problem can be certainly decreased to a certain extent. And because मतलब पानी अगर इवनिंग में कम पियेंगे तो यूरिन प्रोडक्शन कम होगा, यूरिन प्रोडक्शन कम होगा तो कम यूरिन पास करना पड़ेगा. So that is how it will help. Second thing, there are certain food items like excessive tea, coffee, alcohol, or some spicy food that will uh, that will cause worsening of symptoms. If you avoid excessive tea, coffee, even chocolates, cold drinks, and some spicy food, then definitely it will decrease some these symptoms. So these are the
करें।
main lifestyle modification which are very easy to follow, not very difficult actually.
Actually, they are very easy to follow and they are
Yes,
the healthy way of living. So, if we adopt them
yes,
anyways, it's going to help us leading a good, healthy life. Now, doctor,
yeah,
talking about the medical management and surgical, non surgical, whatever way of treatments are available, we would like you to shed some light over them as well.
yeah. Coming to medical treatment, the person whose symptoms are really bothersome means if his life is getting disturbed because of these symptoms, he is the person who needs medical treatment. So medical treatment includes there are two types of drugs. One drug is they are basically called as alpha blockers, and which will relax the urethra and bladder neck so that it will allow to pass urine freely. So alpha blockers, there are many drugs like alfuzosin, tamsulosin, silodosin. These are the commonly prescribed drugs for that. And another type of drug is like dutasteride, which is 5-alpha reductase inhibitor. And what does this drug do? Basically, it prevents further enlargement of the prostate, and over a long period, this drug will decrease the size of prostate as well, but not too much. Like if somebody is having 80 cc prostate, it is not going to become 20 cc by taking dutasteride, but
Mhm.
80 can become 75 or even 70 over a period. Means if he consumes that drug for more than 6 months, even 5 gram or 5 cc decrease in size make a huge difference in urine speed.
Right.
So
Uh,
this is part of medical treatment.
right. And doctor, talking about surgical or non-surgical treatments, if there is any.
Coming to surgical treatment, there are different surgical modalities for this prostatomegaly.
Mhm.
And first, I will come to who needs surgery.
Hmm.
Then I will discuss what types of surgeries are available.
Okay.
So anybody who is not able to pass urine without then that person needs catheter for temporary at least. That person is the absolute indication for surgery because he is not able to pass urine despite he was on medication. He is in retention, so he needs surgery. Second thing, anybody having complications because of prostatomegaly, those are the people who need surgery. Complications in the sense if their kidney function is declining, if they are getting recurrent infections, if they are getting bladder stones, if they are getting dilatation of upper tract, means if there is hydroureteronephrosis or dilatation of kidney and ureter because of back pressure, those are the people who need surgery, and these are the absolute indication. Means yes, they have to do it. One more absolute indication is if any person who is having a lot of residual urine, means after passing urine, if balance is more than 100 ml, then these are the people who need surgery. Also, there is one thing known as means when to do surgery,
Hmm.
because many times what happens, initially our bladder will try to work hard to pass urine. Initially, bladder gets successful, it succeeds, and but over a long period, bladder will become weak. Bladder muscles will change. There will be multiple trabeculations. There will be formation of diverticulum. And when such things happens, or when there is permanent change in bladder musculature, then there is success rate of surgery also decreases. So don't wait too long for your condition to worsen
Mhm.
uh, significantly bad, because then even outcome of surgery will not be very good. Then coming to what type of surgeries are there,
Yes.
most commonly or gold standard surgery is transurethral resection of prostate, which can be done by either monopolar or bipolar energy. Bipolar T or P is relatively safer than monopolar. Then what is this procedure? In this procedure, we will go with one instrument from his urinary passage itself, and there will be one camera we can see on TV what is inside, and with the help of bipolar energy, we'll resect the prostate from inside, and that is how that urine passage becomes wide, and it will be easy for patient to pass urine. Then coming to next level is enucleation of prostate. So those which are larger prostate, like more than 100 cc, those are the people who needs enucleation. And enucleation can be done either by open surgery, which is less preferred option in today's world.
Right.
Then next comes laser enucleation, like holmium laser enucleation of prostate or thulium fiber laser enucleation of prostate, which is latest in the trend. So in enucleation, what do we do? Same as we are going through urethra like previous, uh, we are going through urine passage. Then we are trying to remove entire prostate from its capsule all around, and then we'll remove that gland from the urethra itself.
Okay.
So
Right.
there will not be any incision from outside, and this surgery is totally endoscopic. Yes,
Right. So there are various multiple ways of addressing the managing the problem, but what is required from the patient side is that they, get alarmed and go and get it checked. And trusting
yes,
your doctor
yes,
is another very important thing
correct.
to follow the prescription of what the doctor have said. Now, doctor, there is one more thing as age is one concern, right? Because this is something which is a sign of aging, as we have already discussed. तो एक certain age के बाद जब surgery होती है तो is it safe or people recover well after the surgeries in case they are going for the
Yes,
surgery?
yes, yes. Actually speaking, this problem comes only in old age.
Right.
So this is surgery of old age,
Mm.
and present day anesthesia, present day surgical equipments and surgical care is so much refined that there is hardly, I have not seen a single mortality because of this surgery till date.
Mm-hmm.
Okay. In
Right.
olden days, there used to be deaths because of surgery,
Mm.
but in last 2, 3 decades, this modern medicine is so much advanced. The mortality rate is even less than 1%. Less than 1% means it will be 0.00, that too in particularly high risk case or something like that. But in most of the cases, there will not be any major complication after this surgery.
That's good.
Usually, patient will be in hospital for 2 or 3 days maximum.
Mm.
And in fact, it can be done as daycare as well. Means if patient gets admitted today, operated today, can go home tomorrow morning. That is also possible.
Right. And doctor, how I mean, when a patient comes to you, what are the tests normally get conducted on a patient to diagnose BPH, etc.? So, how do you diagnose it, and what are the various tests that a patient needs to go through?
Coming to diagnosis, first thing is required, that is history taking. Means I have to ask some questions to patient. I have to take
Mhm.
his history in detail.
Mm.
Then comes examination, which includes examination of his external genitalia, means his private parts, as well as I have to examine his prostate by digital rectal examination. That
Mhm.
will give me one estimation ki how big is his prostate. Plus, I have to check consistency of prostate, whether it is benign or whether it is malignant. Means
Okay.
if prostate is very hard, because the same symptoms will come because of prostate cancer as well. But
Okay.
BPH is most common condition. Cancer will happen in few patients, very
Mm.
few. So whether it is because of cancer or whether it is because of non-cancer, so that can be checked by examination. Plus PSA. PSA is one blood test, which is the full form of PSA is prostate specific antigen,
Okay.
which is increased in conditions like cancer. Particularly cancer, it will increase to very high extent. Sometimes it gets increased in infections or some manipulation or some instrumentation in urinary tract as well. But that is different issue. So PSA is one test. History, clinical examination, then some blood investigations like PSA, one urine routine, and his kidney function test. These three tests are compulsory. Then comes to ultrasound. Ultrasound is nothing but we will see. his abdomen from inside, where we gets idea about his kidneys, ureter, bladder, then prostate. How big is the prostate? We can measure the size of prostate on ultrasound. Then pre-void and post-void means how much urine was there in bladder before passing urine and how
Hmm.
much is left behind after passing urine. So that gives us estimate ki how good that patient or how bad that patient is passing urine. If residual urine is very high, it means he has significant problem which needs treatment.
Because we are mostly focusing on BPH, benign prostatic hyperplasia. Benign means which is non-cancerous, and you also pinpoint that the symptoms of prostate cancer are quite similar with BPH. So we would like to talk a bit on prostate cancer as well, doctor. As far as I know, I think prostate cancer is one of the most slowest cancers, right? It spreads because normally cancer is known for the वेट स्प्रेड्स बट प्रोस्टेट कैंसर को इसलिए कई बार अच्छा कैंसर भी कहा जाता है क्योंकि वो बहुत
Yes,
जल्दी नहीं
yes, yes.
स्प्रेड होता है तो
This
थोड़ी
is
जानकारी अगर आप प्रोस्टेट कैंसर को लेकर भी हमारे व्यूअर्स को दें.
what you have told is absolutely correct. If God asks me, I have to give you one cancer, which cancer will you take? I will ask for
Hmm.
prostate cancer
Hmm.
because I know if it is diagnosed early,
Hmm.
there are good treatment options which are almost curative.
Hmm.
I'm not saying complete curative, but almost curative, and patient will live his life without any problem, or he will not die of prostate cancer if it is diagnosed early and treated on time.
Hmm.
Of course, if it is not treated and if it spreads in body, then consequences are bad. But there are good treatment options available in prostate cancer.
Okay.
Coming to prostate cancer, it is one of the most common cancer in male after oral cavity cancer or lung
Okay.
cancer. So it is one of the top three common cancers in male.
Hmm.
Then symptoms of prostate cancer are similar to what it happens in enlarged prostate because of
Hmm.
non-cancerous reason.
Hmm.
So symptoms are not different, same like difficulty in passing urine, frequency, urgency, nocturia. Then
Hmm.
sometimes patient may pass blood in urine, then recurrent UTI or sometimes kidney failure as a complication.
Hmm.
So symptoms are quite similar. There
Similar.
is no specific symptom of prostate cancer, but to diagnose prostate cancer, there are three things which are required. One is clinical examination,
Hmm.
second is PSA, and third is MRI. So there is one special MRI called as MPMRI prostate, multiparametric MRI for prostate. If there is doubt on either of these three, means even if you feel clinically it is malignant, or if PSA is raised, or if there is suspicious lesions on MRI, then we have to direct our management towards prostate cancer. Means first we need confirmation of diagnosis, for which biopsy will be done. So based on biopsy, we will come to conclusion whether it is cancer or not. And if it is cancer, then there are different means treatment options depending on stage, whether it is localized, locally advanced, or metastatic, means if it is spread in many places in body. So treatment options varies, and it's a huge topic of discussion that can be discussed sometime later.
Hmm. Definitely.
Yes,
Definitely.
yes,
But at least we now know that because the symptoms are quite similar in both benign prostatic hyperplasia and
yes,
prostate
yes,
cancer, ये ज्यादा इंपॉर्टेंट हो जाता है कि हम ये सिम्टम्स इग्नोर ना करें. अगर ये सिम्टम्स हैं तो
right.
डॉक्टर को जरूर दिखाए, क्वालिफाइड यूरोलॉजिस्ट को जरूर दिखाए क्योंकि भले ही चांसेस कम हो लेकिन वो रूल आउट करना जरूरी है कि ये प्रोस्टेट
Yes,
कैंसर
yes,
नहीं है. और अगर इन केस है तो फिर उसका जितनी जल्दी ट्रीटमेंट होगा जैसा कि डॉक्टर ने बताया वो एक तरह से क्यूरेबल है. तो लेकिन उसके लिए जरूरी है कि अर्ली डिटेक्शन हो. तो इसकी बहुत जरूरी है कि
yes,
जो सिम्टम्स है उन्हें हम इग्नोर ना करें. राइट डॉक्टर?
correct. One more tip I want to give, particularly prostate cancer. Some variants of prostate cancer they run in family. So
ओके.
anybody having family history of prostate cancer, if somebody's father or grandfather is having history of prostate cancer, their subsequent generations
Hmm.
they should start getting their PSA done at the age of 50. Means
Okay.
for normal people, we will consider it as a 55 or 60. But in those people who have family history of prostate cancer, they should get their PSA done from the age of 50, so that if there is any possibility that yes, PSA is increasing, we can do biopsy, we can do certain evaluation, and if he has prostate cancer, we can give him cure if detected early.
राइट, अगर फैमिली हिस्ट्री है तो
They
जल्द से
should,
जल्द जो है अपने
yes,
यूरोलॉजिस्ट से संपर्क करें और संपर्क में रहे
yes,
और रेगुलर
yes,
चेकअप्स
yes,
करते
yes, yes, yes.
हैं. So there are a few questions which our viewers have asked, तो मैं उन्हें ले लेती हूँ. यश नामदेव है, उनका क्वेश्चन है, how does BPH impact sexual function and are there any treatments or strategies to address these concerns?
Actually speaking, after prostate enlargement, there will not be any effect on sexual function. Sexual function or sexual dysfunction can happen because of some other reason.
Hmm.
But uh, one more thing is those who are on medications for prostate, means prostatomegaly,
Hmm.
they will get one small side effect which is called as retrograde ejaculation. Means the semen which should come outside after sexual intercourse or masturbation, that semen in many patients that semen don't come out completely. Some part of the semen goes into bladder because the drugs which we are giving for prostatomegaly, they will relax bladder neck, and bladder neck should be closed at the time of ejaculation so that ejaculation should be antegrade or ejaculate
Hmm.
should come outside. And
Outside.
because we have kept his bladder neck relaxed by giving medication, some part of semen goes inside, and there is nothing to worry about it because it will not affect your erectile function or even your orgasm will not be hampered. Only thing is some part of ejaculate will not come outside and some part goes inside. So there is no harm in that. And because most of the time these drugs are given only in old age, so family will be already completed by that time. So there is
Hmm.
no issue.
Right.
Yes.
We have Deepak Saxena with us. His question is, how often should I come in for checkups to monitor my BPH and overall prostate health?
At least once in a year. And if you have some problem, then your visits may be even frequent, but at least once in a year is routine.
Hmm. Right. Ajit Singh is asking, is there anything I should specifically avoid or be cautious about because of BPH?
There is nothing that can be avoided to prevent BPH, and BPH is a or enlargement of prostate is part and parcel of normal aging process. So there is nothing can be done. Like we
Hmm.
cannot, there is no role of any diet or any exercise or anything.
हम्म. लेकिन जैसे डॉक्टर शुरू में हमने बात की कि बालों का सफेद होना जितना नेचुरल है उतना ही प्रोस्टेट का बड़ा
Yes,
होना भी
yes,
नेचुरल है. लेकिन कई बार
correct.
ना बालों का सफेद होना प्रोलॉन्ग कर सकते हैं, डिले कर सकते हैं बाय कीपिंग
Oh,
चेक ऑन आवर डाइट एक्सेट्रा. अगर
yes,
वो
yes.
जेनेटिक है फिर हम कुछ नहीं कर सकते, बट फिर भी हम
नहीं
प्रोलॉन्ग
नहीं.
कर सकते हैं. क्या
Yes.
प्रोस्टेट एनलार्जमेंट को भी किसी तरह से प्रोलॉन्ग
नहीं,
डिले
there
किया
is
जा
nothing
सकता है?
to prevent prostate enlargement. There is no magic or no medicine or nothing.
हम्म.
Medicines, yes, there can be, but we cannot give it as a prophylaxis.
हम्म. अच्छा, कई बार जो हमने सिम्टम्स डिस्कस किए उसमें से रात में बार बार उठना यूरिनेशन के लिए, ये बहुत होता है. एंड ओल्ड एज में एक तो ये ट्रबलसम तो है ही एनीवेज, क्योंकि आपकी साउंड स्लीप नहीं हो पाती, आप दिन भर टायर्ड रहते हैं, रिस्क फैक्टर भी बढ़ जाता है क्योंकि आपकी नींद नहीं हुई है, नींद में आप बार बार उठ रहे हैं, बाथरूम जा रहे हैं, विच कैन बी स्लिपरी. कई बार स्लिप हो जाते हैं और ओल्ड एज
Hmm.
में बोन से रिलेटेड प्रॉब्लम्स भी हो जाती है. तो ऐसी तमाम चीजें हैं जो इसके साथ जुड़ी हुई होती हैं. लेकिन कई ऐसे लोग हैं जो रात में 2-3 बार उठना बहुत, उनको लगता है ये तो कॉमन है, 2-3 बार तो उठते ही हैं. कई ऐसे
Because they
लोग
get
हैं जो उठते
habituated.
हैं. हाँ,
Hmm.
राइट. कई ऐसे लोग हैं जो उठते हैं, वॉशरूम जाते हैं, वापस आते हैं, फिर एक ग्लास पानी पीते हैं, फिर सोते हैं, फिर 2 घंटे बाद उठते
Hmm.
हैं. तो ये जो छोटी छोटी चीजें हैं, इनको लेकर खास तौर पे हमारे वो व्यूअर्स जो एज्ड हैं और जिनको अभी भी लगता है क्योंकि उनकी आदत हो गई है कि रात में उठना है, सो ओके, क्या आप कहना चाहेंगे, कितनी बार उठना ओके है, क्या करना चाहिए, क्या फिर से पानी पीना चाहिए रात में बार बार? हालांकि पानी को लेकर आपने डिटेल में बात की है, लेकिन फिर भी
Yes.
इस स्पेसिफिक क्वेश्चन के लिए।
Ideally, there should not be any need to wake up in night to pass urine.
हम्म।
So that's the reason why young male or those who don't have this problem, they don't wake up or hardly once in a night is acceptable. But anything more than one is not normal. And this can be controlled or decreased just by lifestyle modification. Like after 5 o'clock, many people have habit of drinking 2 3 glasses of water every time. There is no need to drink so much of water, particularly in evening.
हम्म।
Yes, in daytime you can drink, but after 4 o'clock, 5 o'clock,
हम्म।
try to limit your water consumption. Or even some, there are certain things like tea, coffee, alcohol. They are having diuretic properties, like they will produce more urine. So
हम्म।
if we avoid these things in evening, yes, it will help a lot.
And how about alcohol and smoking? Do they, I mean, contribute in triggering the bladder or something like that?
Frankly speaking, alcohol and smoking, they are dangerous for overall health.
True.
Okay, including bladder and prostate, particularly cancer.
Hmm.
Okay, so smoking and drinking is not acceptable or permitted. Social drinking means once in a while, once in a fortnight, or small dose of alcohol, that is fine or fair enough. But the regular consumption of alcohol and smoke is more dangerous than even alcohol. So these things should be avoided as far as possible.
राइट। कई बार जब मेडिकल मैनेजमेंट हो रहा है प्रोस्टेट का, तो कुछ समय बाद ये अगेन एक बहुत कॉमन टेंडेंसी है हमारी सोसाइटी में कि बिना कंसल्ट किए डॉक्टर से हमको लगता है कि अच्छा थोड़ा आराम मिल गया है, तो हमने प्रेस्क्रिप्शन फॉलो करना बंद कर दिया। फिर थोड़ी देर बाद हमको
Ah,
लगता है कि अच्छा ये सिम्टम्स वापस
yes,
आ गए,
yes.
तो फिर हमने प्रेस्क्रिप्शन लेके दवाई लेके अपना ट्रीटमेंट शुरू कर दिया। तो ये जो सेल्फ मेडिकेशन है, ये कितना खतरनाक हो
I
सकता
will
है?
give you one. This is actually very important point to discuss because many people they think कि अभी डॉक्टर ने 1 महीने का मेडिसिन दिया है, 1 महीना खाया, उसको अच्छा लगा, फिर उसने छोड़ दिया, फिर उसको फिर से वो सिम्टम चालू हो गए, फिर वो दूसरे डॉक्टर के पास जाएगा, फिर वो तीसरे डॉक्टर के पास जाएगा.
हाँ, हाँ।
तो बेसिकली treatment for this condition is for long term, and many patients it will be required for lifelong. So first of all, be prepared to accept that ki you have prostate, you are man, and you are having these problems. So it will need treatment on long term, and there is no need to go to one from one doctor to another, from another to third one, fourth one, like that. There is no magic. So, but these drugs can give good quality of life, and it can improve your urinary function quite a lot.
Right. So, because treatment is there and you will get relief, so there's no point in suffering in silence. I mean, talk about
Yes,
it. If you have these symptoms, come out, talk to your family, go to the doctor, take advice, take treatment. और घर में भी अगर हमें हमारे जो बुजुर्ग हैं घर में लग रहा है कि वो बार बार वॉशरूम जा रहे हैं, रात को भी बार बार उठ रहे हैं, तो हमें भी उनसे बात करने की जरूरत है और उन्हें
yes,
डॉक्टर के
yes,
पास लेकर जाने की जरूरत है।
correct.
Doctor, before we sum up the whole session, any take home message for our viewers?
Take home message is don't neglect your urinary symptoms, and particularly those who are having family history of prostate cancer, please get your prostate evaluation done from the age of 50 and annually at least once. It is not required very commonly, but at least once in a year is very essential. And second thing is come for follow up because by comparing the response, doctor can decide whether to increase the dose or whether to decrease the dose or whether to change the medication. So follow-ups are very much essential and be in contact with your urologist. That's all. Thank you.
Thank you so very much, Dr. Akash. It was wonderful talking to you. Thank you for your valuable time and this very informative session. Thank you so very
Yeah.
much.
Thank you. Thank you.
And viewers, thank you for your active participation. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, Instagram. Thank you. Have a great day ahead. Goodbye.
Thank you.